Hello everyone, a warm welcome to all my audience. My name is Priya Singh Rangey. I'm an assistant professor at the LJ Institute of Physiotherapy, and today we'll be talking about extension services in rehabilitation. So today we'll be discussing about the main barriers to different healthcare services and what does the extension service mean, the objectives of these extension services, the advantages and the functions of extension services. So, beginning with what are the different barriers to healthcare services? As we can see in our healthcare system is something that is based on the modern medicine, which is more derived from the Western kind of medicine. And we sometimes forget that when we talk about the Indian population, most of the Indian population resides in the rural areas, and for them, it is quite difficult for them to understand what the Western system of medicine is. Also, when we look at the healthcare system that is prevalent in India today, there are so many inaccessibilities that these people face because most of the healthcare systems are developed in urban areas, or they are at places which are quite far away from the actual population which requires them. So because of this, there is unavailability also at certain level, because when we talk about healthcare system, we do not have different hospitals, multi-speciality hospitals at the rural areas, in the rural sector. They barely get even a small sub-center level of healthcare system. So many a times they face inaccessibility to healthcare services, and sometimes there aren't any healthcare services available. The other barrier which we face is the lack of financial support, because India is still a developing country and we need to contribute the finances to different sectors. It becomes quite difficult to give more financial resources to the healthcare services. Hence, there is lack of financial support as well. There is lack of transportation. When we look at rural areas, there are many villages, there are many remote areas where there is a lack of transport. People cannot transport from one place to another, and that also is a barrier because people do not have any means to transport to come to the healthcare services. Healthcare is not a priority sometimes because the government needs to focus on many other things. They need to focus on development, they need to focus on providing nutrition and shelter, which is more important for the livelihood. And during these times, healthcare takes a back step and it does not become a priority. Lack of service coordination is also seen between different areas, different fields, because many a times the people do not refer the patients to other fields. Many a times it happens that people do not have any referring system. There is no referring system available. Then how can people refer the patients to someone else? So because of this also, there is a lack of service coordination. That again is a barrier to the healthcare service, because in such a scenario the patient will not be made available whatever service the patient requires. Chronic homelessness is a problem because on some day the patient may be residing in one area, on the next day the patient may go to some other place, and so it becomes difficult to take a follow up of that particular patient. And in such a scenario, it also becomes difficult for the government to establish healthcare service infrastructure, because they do not realize where the population density is more, in what areas do we need to focus on. So chronic homelessness is also a barrier to the healthcare service system. The population that resides in our country is not that educated, and even in the people who are educated, there is a lot of unawareness. And this unawareness about the existing services, that also becomes a barrier, because people do not know where to go to avail these services, whether they can avail the benefit of these services or not. And because of this unawareness, because of this lack of uh, awareness, it becomes difficult for the people to come to gain these kind of services. So these are the different barriers to the healthcare services that are available in our country. In order to eliminate these barriers, or as a step in order to move further beyond these barriers, the system of extension services has been developed. In extension services, what we do is we try to extend the rehabilitation services as close to the people who need them as possible. It is a linkage model of the CBR, which is community based rehabilitation, and we use these extension services in order to perform early intervention, identification, prevention of disability, and services within the community. The main objectives of extension services are that it is cost effective, which is the main benefit that we can see here for the people. Because when we talk about a nation like ours, which is a developing country, the people are not that financially independent in order to gain healthcare services from private infrastructure, private organizations. Hence, it is a boon for these people, because extension services usually are paid by the community and or by the government, and the people do not have to pay for them. So the cost effectiveness is a boon for the people who usually require them. The extension services, like I said, are supported by the community resources, community manpower, and materials. So the community itself is trying to support the person with disability, is trying to help the person with disability by providing financial resources, by providing manpower and material. Hence, what we are trying to do in an extension service is that we are trying to perform community based rehabilitation by using resources that are available in the community. In this way, we are trying to create awareness in the community as well. Because of extension services, we can see early detection of many disorders, and because of this early detection of the disorders, we can prevent certain impairments, we can prevent disability, we can prevent handicap. So early detection is again something that is required in today's scenario. There is also early intervention, because once we are detecting any disorder early, we can intervene at an early point and we can change the path in which the disease might have progressed if intervention was not have been provided. This intervention can be medical intervention, it can be educational intervention, vocational intervention, social intervention, any form of intervention can be provided. Awareness can also be spread through extension services. We can use posters, manuals, or we can perform certain kinds of skits or puppet shows in order to create awareness among the people. Extension services also provide training programs in order to train the people residing in the community, the volunteers from the community, so they can help the person with disability who are residing in their community. Next, moving on to the advantages of extension services. Extension services are helpful in performing screening of potential patients. Because of the screening, we can eliminate the people who do not require help from the hospitals, and we can try to focus on the people who actually require medical attention. We can use these extension services in order to educate the people, in order to educate the family in the community. We can warn them about what are the different signs and symptoms of the different diseases, what can be done in order to prevent certain disorders, and if the disorder has already taken place, if the patient is suffering from disability, how to deal with that problem. That can be educated to the people, and also we can provide treatment for the disabled patients. The functions of extension services are identification, extension of direct service, referral services, establishing a rapport and acting as a beneficiary for the patients, conducting health camps, scheduling for services, follow-up services, and creating self-help groups. We'll be discussing these points a little in detail now. Identification of the different patients. The field worker here plays the key function when we are talking about extension services, because it is the field worker who performs the main task of identifying certain diseases, identifying potential patients, And the success of any extension service project is going to depend on the performance, the integrity, the sincerity, and the devotion of the field worker. If the field worker is not devoted to this task, the extension service will not be able to avail the advantages or the benefits that it was planned to do. In extension services, services are provided door to door by performing a survey. We screen with specialized personnel. We collect different kinds of data. We establish individual care. Since we are performing a door to door survey, we can individually assess the patients. We can individually treat the patients, and we can perform an initial assessment of each case. After this initial assessment is performed, we can perform a screening whether the patient requires further intervention or not. If the patient requires a further intervention, we can apply the intervention, or we can refer the patient to any other services. So that is identification. The next function of extension services is extension of direct services. Here we are trying to extend the medical services directly to the patient, so the patient does not come to us in order to seek the medical benefits or seek healthcare services, but we are going to the patient in order to give them a direct service from our part. Individual family counseling can be done. We can train the patient for mobility, for orientation. We can make the patient independent in performing their ADLs. We can arrange for monetary concessions. If in case the patient requires any financial help, we can help them by getting some donations, some scholarships, etc. We can arrange for momentary assistance. Many a times it may happen that the patient may not require a long-term care or a long-term assistance, and the assistance is only required for a short-term period. In that scenario, we can arrange for any kind of help or any kind of caregivers for the patient. We can create public awareness among the community about all the different diseases, the pathologies, the disability, what are the different problems of the disabled persons, and how the community can help the persons with disabilities. We can use extension services as referral services, because since we are going to the patient directly and we know what problems the patient is facing, and if in case it seems that the patient requires some further help from a specialist, then we can refer the patient to the care of a specialist. And with this, we can notify the local hospital about the specific problems that the patient has, so that the patient gets better care. We can also refer the school children to integrated education program, which usually is being undertaken nowadays in the schools, that we see not special education but integrated education, so that even the children who have special needs can study or get themselves educated along with children who seem to be normal. We can refer the children with multiple disabilities or with severe disabilities to residential institutions where they can get more help that they require. We need to establish a good rapport with the patient, and we need to act as a beneficiary to the patient. For this, we need to provide a brief introduction of the project that we are undertaking in order to gain the patient's faith. It is quite normal that when we talk to a person, when we try to explain something to a person, it may seem to the other individual that we are just trying to do this for our own benefit. Hence, we need to explain the entire process to them so that they understand that it is actually for their benefit, it is actually for their advantage and not for our advantage. And for this, we need to give a brief introduction about us, about the project that we are undertaking, how it is going to be helpful to the individual, what the individual needs to do in order to get maximum benefit out of it. And illustration of a successful case of completed rehabilitation can be given, because when we are using an example in order to explain something, it can be explained in a better manner. And this same thing needs to be done when we are talking to a patient. We need to give an illustration of a completed rehabilitation case so that the patient understands that if I undergo rehabilitation, what benefits am I going to get, in what manner is this rehabilitation service going to be helpful for me, whether it is going to be helpful or not, am I going to be benefited by this or not. We need to explain the patient the aims and objectives of the project, the extension service that we are providing. sometimes it may happen that the patient is quite under the influence of their family. In such a scenario, we also need to communicate with the family. We need to talk to them. We need to convince the family so that the person can do meaningful work. Also, when we are performing any kind of extension service, we need to remember that the socio-economic condition of the patient plays a key part, because if the patient doesn't want to perform or doesn't want to go for rehabilitation, we cannot help them. And when we seek a patient, or when we are trying to perform a service for a patient who belongs to a good socio-economic condition, it's quite easier to explain things to them. Also, the patient will be more ready in order to come into the rehabilitation service. When we talk about a patient who belongs to a poor socio-economic condition, it is quite difficult for them to understand what we are trying to do. Also, these people may not have the time or the energy in order to come for rehabilitation services. They may not have those resources that we might need them to have, because for them, their daily livelihood is more important than any rehabilitation plan. So that is why we need to consider the socio-economic condition as well, and we need to perform the rehabilitation accordingly. We need to conduct different health camps like free checkup camps, general healthcare camps, child screening camps, etc. We can schedule for different services like social integration. Individual counseling can be performed using the home economic situation. We can have the patient being provided concessions like traveling concessions if the patient is living far away. If we cannot give daily services to the patient, then we can give travel concession to the patient, so the patient can go to the hospital if to avail the services. We can have the patient get disability pension or scholarships. Age specific services can also be given, like integrated education for children who lie between the age of 5 to 12 years, vocational rehabilitation for people who lie between 18 to 65 years, social rehabilitation for those who are above 65 years. And we also need to focus on follow-up services, because extension service is not just that we perform a screening, we intervene, and then we just go back to our daily life. It does not work that way. We need to give follow-up services as well. We need to continue rehabilitation facilities through regular home visits and checkups, so that we can know whether the patient is having any needs or problems in the future. And we also need to focus on creating self-help groups, because we cannot provide services forever. We need to focus on other populations as well. We cannot just keep on looking at one specific area. Hence, we need to create self-help groups so that people can help themselves. We can form groups using the family members of people with disability. The people with lesser amount of disability can try to formulate these kind of groups, and they can meet once in a while to discuss among themselves what their requirements are, what their needs are, and how they can help each other. So that is the end of extension services. Extension service providers should work towards the aim of inclusion and equalization of opportunities for persons with disability, and they have a direct contact with the community, and hence they can make better efforts for disability prevention and health promotion. And this service system should be utilized to the maximum, so that the persons with disability can avail maximum benefits, and we can work with the community for the betterment of the community. Thank you.